So the complications for the cholelithiasis can be biliary colic, acute cholecystitis, and chronic cholecystitis. So these are the common clinical manifestations, but the other complications, which are most commonly in an immunocompromised patient or diabetics, can be empyema of the gallbladder or mucocele. The only difference between empyema of the gallbladder and a mucocele is like already been told, the empyema would be infected. Okay, so when there is a stasis and obstruction, there would be stasis of the bile, and there would be obviously the stasis will lead to the growth of the anaerobic flora, and there would be infection of the gallbladder that would be called as empyema. And a mucocele is like there is obstruction, but there is just a sterile bile without any neutrophils or without any causative organisms. That is called as a mucocele. So empyema and a mucocele is more common in the diabetics and the immunocompromised people. But other conditions like biliary colic, acute cholecystitis, and a chronic cholecystitis, they can be normal clinical presentation in almost 10 to 15% of the patient, because 80% of the patient with the gallstones, they are actually asymptomatic, and it's just the incidental finding. Other complications that can be because of the cholelithiasis, that can be the perforation of the gallbladder. So how actually this perforation takes place? The mechanism is that when there's a stasis of the bile and the gallbladder is distended and the wall is thickened, there's a possibility of the necrosis within the wall of the gallbladder. So whenever there's a necrotic area of the gallbladder, that is easily, or you can say it's fragile to rupture, or it's fragile to perforate. So that's how a perforation can actually take place. Or there can be biliary obstruction. Okay, so the mechanism for the biliary obstruction is simply remains the same. That is the slipping of the stone all the way in any part of the duct, most commonly the common bile duct. So if there is a stasis within the common bile duct, so the patient will actually present to you with the obstructive jaundice, and whenever you're trying to investigate such a case, there will be raised in serum alkaline phosphatase. As compared, there can be raise in LFTs like the AST and ALT amino aspartate transaminase, or there can be alanine transaminase increase elevation, but it's relatively smaller or insignificant as compared to the ALP. The ratio of ALP to other liver function tests would be more increased as compared to AST and ALT. And it can lead to the biliary obstruction. Stasis can lead to the acute cholangitis. That's the whole of the biliary channel, or a biliary tree is not only being dilated, but there is a element of infection as well. So that can lead to acute cholangitis. There can be acute pancreatitis, obstructing the main pancreatic duct, stone all the way slipping from the main pancreatic duct and causing the acute pancreatitis, which is called as the gallstone pancreatitis or the biliary pancreatitis. Or there can be intestinal obstruction. Okay, so this intestinal obstruction is not very much common. It's only common, or you can say the percentage is like 2 to 3% of the people. But the stone all the way can got obstructed anywhere, if the stone is larger enough to obstruct the lumen of the small gut, mostly the ileum. So that can lead to the biliary ileus, and the patient can actually present to you with intestinal obstruction. And we know that the signs of the intestinal obstruction would be abdominal distension, absolute constipation, and vomiting and severe abdominal pain. And when you're trying to investigate such a case, there would be no other cause other than the gallstones. Then you will think about the gallstone ileus or a biliary ileus.